Welcome to the Deep Dive. Today we're diving into a topic that might initially seem quite simple, chronic diarrhea in cats.
Right.
But as the information you've shared with us shows, it's actually, well, surprisingly involved.
Yeah.
It can be a red flag for a whole range of underlying health problems.
That's absolutely right. While an occasional upset stomach might not be a huge deal, persistent digestive issues in cats, that really warrants attention.
Yeah.
So our goal in this deep dive is to really get into that complexity. We want to pull out the essential info, give you a clear picture of what chronic diarrhea in cats is, why it happens, and how vets typically approach figuring it out.
Trying to bring some clarity without getting totally lost in the weeds.
Exactly. Empower you with knowledge, but keep it manageable.
Okay, and let's start with something I found pretty surprising from the sources. It doesn't take a huge change in a cat's stool to count as diarrhea.
No, it doesn't.
We're talking like a 2 or 3% increase in water content. Just that tiny bit is enough for us to see it as diarrhea.
It's fascinating, isn't it? Changes the perspective a bit.
It really does.
Yeah.
Okay, so let's unpack this. When we say chronic diarrhea, what exactly are we talking about? What's the definition?
So essentially, chronic diarrhea means there's a change in their bowel habits, and it lasts more than 3 weeks. Or it keeps coming back in episodes.
Okay, more than 3 weeks are recurring.
Yeah. And that change includes things like how often they go, the consistency, how loose or watery it is, and often the overall amount or volume.
Right.
And then, importantly, we try to figure out where the problem seems to be starting. Is it the small intestine, the large intestine, or maybe, a mix of both?
So it's not just that they have diarrhea, but how it presents. That makes sense. Now, what's actually going on inside? Like physiologically, what are the mechanisms?
There are basically 4 main ways chronic diarrhea can happen, but often they kind of overlap.
Okay.
First, you can have too much fluid and solutes being secreted into the intestines. That's called secretory diarrhea.
So the gut is sort of leaking fluid.
In a way, yeah. Or actively pumping it out. Then second, you can have the opposite. Not enough fluid and solutes being absorbed out of the intestines. That's osmotic diarrhea.
Got it. Too much going in or not enough coming out.
Precisely. Third, the lining of the intestine itself might become too leaky, too permeable. Think of it like a screen door with holes that are too big.
So stuff gets through that shouldn't.
Exactly, including excess fluid. And finally, the fourth way is when the normal movement of the gut, the motility, gets messed up. Too fast, too slow, uncoordinated.
And you said these often happen together.
Very often, yes. It's rarely just one mechanism in isolation. It's usually a combination causing the problem.
Right, so it's a bit of a domino effect sometimes in their digestive system. Now, from an owner's perspective, what are the key things you should be watching for at home? How can those observations help point towards, say, small bowel versus large bowel?
Oh, the details you can provide are incredibly valuable, really crucial. For small bowel diarrhea, you might see a normal amount of stool or even a larger volume than usual.
Okay, more volume.
Yeah. And the frequency might be normal or just slightly increased, maybe 2 to 4 times a day. But because the small intestine is key for nutrients.
Weight loss.
Weight loss is pretty common, yeah. Even if their appetite seems fine, or sometimes even increased.
Interesting. What else?
You might notice dark, tarry stools. That's called melena, and it suggests bleeding higher up in the GI tract. Maybe some extra gas, rumbling sounds, we call that borborygmus, and vomiting can happen, but it's variable.
Okay, that paints a pretty clear picture for small bowel signs. What about the large bowel? How does that look different at home?
Yeah, so with large bowel issues, the stool volume is usually smaller per movement, but they go much more often.
More frequent, smaller amounts.
Exactly. Often more than 4 times a day, sometimes quite a bit more. And because the large bowel mostly handles water, weight loss is less common.
Makes sense.
But what you might see is fresh red blood that's hematochezia or mucus in the stool. That's quite characteristic.
Okay. Red blood or mucus points more towards the large intestine.
Generally, yes. Also straining to defecate, what we call tenesmus, or seeming like they have to go right now, that urgency. And sometimes it might even seem painful for them, which is dyschezia.
Straining and urgency, got it.
Gas and rumbling can still happen, and vomiting is, again, sort of variable. But those differences in frequency, volume, blood, and mucus are really key clues.
It's like reading the signs their body is giving.
Precisely. It's a kind of silent language.
Okay, that's really helpful for owners observing at home. Now, when we take the cat to the vet, what are they looking for during the physical exam?
Well, a full physical exam is absolutely essential. And that always includes feeling the abdomen, carefully palpation, and doing a rectal exam.
Right.
If we're thinking small bowel, the vet might find the cat is in poor body condition, maybe a bit dehydrated. They might feel thickened loops of small intestine, or perhaps enlarged lymph nodes inside the abdomen.
And the rectal exam in that case?
Often, the rectal exam itself might be pretty normal if the problem is higher up in the small intestine.
Okay. And if the suspicion is more towards a large bowel problem, what might the vet find then?
With large bowel disease, the cat's overall body condition is often better, maybe more normal. Dehydration is less common too.
Okay.
But during palpation, the vet might feel a thickened large bowel or enlarged lymph nodes near the colon. And the rectal exam can be more revealing here. Maybe they feel irregularities, masses, strictures, or, again, enlarged lymph nodes in that area.
So the history we give and the physical exam provide those crucial first clues. But let's get into the underlying why. What are some of the actual diseases or conditions that cause chronic diarrhea in cats? It seems like a long list based on the sources.
It is a very extensive list, yeah. Which is why diagnosis can sometimes be, a bit of a process. We can kind of group the causes to make it clearer.
Good idea.
First, you have diseases directly affecting the intestines, primary intestinal diseases. This includes things like IBD, inflammatory bowel disease.
There isn't one single thing, right? It's like an umbrella term.
Exactly. Like saying arthritis for joints, it covers several chronic inflammatory issues. Then there's cancer. Lymphoma is a big one in cats. Adenocarcinoma too. Bacterial infections like Salmonella, certain E. coli, Clostridia.
Viruses too?
Yeah, viruses like enteric coronavirus, FIP virus, sometimes linked with MLV or FIV. Fungal infections, though less common, like histoplasmosis. Other weird infections. Parasites, of course, Giardia, roundworms, hookworms, whipworms, coccidia.
Wow. Okay. Keep going.
Partial blockages, maybe from a foreign object or a stricture. Something called secondary lymphangiectasia that affects lymph drainage and absorption. Bacterial overgrowth or imbalanced dysbiosis. Short bowel syndrome if they've had surgery. Even things like duodenal ulcers.
It's amazing how many different things can upset the gut like that.
It really is. And often, like we said, there's overlap. A food issue might trigger inflammation, which makes the gut leaky. It all connects.
Right, the categories help, but the body doesn't always stay in neat boxes. What other big categories of causes are there besides primary gut diseases?
We also think about maldigestion. That could be from not enough bile salts, maybe due to liver or gallbladder problems, or the pancreas not making enough digestive enzymes, that's exocrine pancreatic insufficiency, or EPI.
Okay, digestion problems.
Yeah.
And diet.
Absolutely. Dietary factors are huge. Food intolerance, it's sometimes called food-responsive enteropathy, true food allergies, or even just switching diets too quickly.
Yeah, I think many owners have experienced this sudden diet change issue.
For sure. Then there are metabolic disorders, things happening elsewhere in the body that affect the gut.
Like what?
Hyperthyroidism is a classic one in older cats. Cobalamin or B12 deficiency. Kidney disease causing uremia, liver failure, exposure to toxins, or bad reactions to medications.
So problems with other organs can manifest as diarrhea.
Definitely. And finally, though less common, there can be congenital issues, things they're born with, like a short colon or a liver shunt.
Wow. Okay, that really covers a huge spectrum. Given this massive list, are there specific things that might make a cat more likely to develop chronic diarrhea? Risk factors.
Yeah, there are a few. We already mentioned sudden diet changes. Feeding diets that are poorly digestible or consistently very high in fat can also contribute, kind of stressing the system over time.
Right, diet quality matters.
Yeah.
Okay, so we get what it is, the potential causes.
Yeah.
Now, how do vets actually unravel this mystery? How does the diagnostic process usually work?
Well, the first step is usually trying to localize the problem, small bowel, large bowel, or mixed, based heavily on that history you provide. The signs you noticed at home.
Okay, history first, then tests.
And tests, yes. We almost always start with baseline lab work. A CBC, complete blood count, a biochemistry panel, and a urinalysis.
What can those tell you?
A surprising amount. For instance, high eosinophils, a type of white blood cell, might point towards parasites or certain types of IBD. Changes in red blood cell size could hint at hyperthyroidism or FLV. Anemia might mean chronic bleeding somewhere. Low white cells could suggest FLV or FID. The biochemistry can show protein loss, like low albumin, which is common with intestinal disease. Or it might flag problems with the kidneys, liver, pancreas, pointing us towards those metabolic causes we mentioned. Urinalysis helps assess kidney function, too.
So those first blood tests give a really broad look. What about checking the poop itself?
Absolutely critical. Fecal exams and sometimes rectal scrapings. We use different methods: flotation, wet preps to look for parasite eggs or organisms like Giardia. We can also look at cells under the microscope, cytology, to check for certain bacteria, fungi, or inflammatory cells.
What about those PCR tests on stool?
PCR can detect genetic material of bugs, yeah, but you have to be careful interpreting them. Just because a bacteria or virus is there doesn't mean it's causing the diarrhea. Many can be present normally.
Fair point. Needs context.
Exactly. And if we specifically suspect salmonella, we need to do a bacterial culture, which is different.
Okay. What other specific blood tests might be run? You mentioned hyperthyroidism earlier.
Right. So we'll often check thyroid hormone levels, usually T4. If it's normal but we're still suspicious, there are other thyroid tests we might do. And we definitely test for FLV and FIV, especially if the CBC shows weird things or if the cat's history is unknown. And for suspected EPI, that pancreatic issue, there's a specific blood test called TLI, or sometimes FPLI.
Got it. Lots of info from lab tests. What about looking inside? Imaging, X-rays, ultrasound.
Imaging can be very helpful. Regular X-rays, survey radiographs might show obvious things like a blockage, weird gas patterns, big organs, maybe a foreign object or fluid in the belly. But they're often not detailed enough for just chronic diarrhea causes.
So limited usefulness sometimes.
Can be. Contrast X-rays where they swallow barium or something similar can sometimes show thickened walls or ulcers. But honestly, we use abdominal ultrasound much more often now.
Why ultrasound?
Ultrasound gives us a much better look at the layers of the intestinal wall. We can measure thickness, see if the layering is normal, spot masses, check lymph nodes nearby, look closely at other organs like the pancreas, liver, kidneys. It's very informative.
Better detail.
Much better detail. We often use X-rays and ultrasound together. They complement each other.
Okay, so let's say the initial tests, maybe the imaging, haven't given a clear answer. What comes next? More involved procedures.
Yeah, if we've ruled out the more common things, parasites, diet issues, metabolic problems, we might try an empirical dietary trial first.
Like an elimination diet.
Exactly. Usually a novel protein or a hydrolyzed protein diet. Give it a strict try for at least 2, maybe 3 weeks. See if things improve.
And if that doesn't work?
If the diet trial doesn't help significantly, then we usually need to think about getting tissue samples biopsies. Endoscopy is one way.
The camera scopes.
Right. We can go down into the stomach and upper small intestine or up into the colon. It lets us see the lining and take small pinch biopsies.
You need many samples.
Oh, yes. Really important to take multiple biopsies, like 8 to 10 from each section, even if it looks normal to the eye. The important changes are often microscopic.
Good to know. Any limitations to endoscopy?
The main one is that the biopsies are pretty superficial, just the top layers, and standard colonoscopy can't reach very far up the colon in cats. For full-thickness biopsies, especially of the small intestine, you might need surgery.
Like actual abdominal surgery?
Yes, either traditional exploratory surgery, which lets you sample multiple organs easily if needed, or sometimes laparoscopy keyhole surgery for less invasive full-thickness gut biopsies.
Okay. Are there other ways to get samples?
Sometimes if there's a specific mass or a very thick area seen on ultrasound, we might try an ultrasound-guided needle aspirate or a tiny core biopsy. But these have limitations, especially for diagnosing diffuse diseases like IBD.
Right. And what if there's fluid in the abdomen?
If there's fluid, a paracentesis, taking a fluid sample with a needle, is done. We analyze the fluid, look at cells, maybe culture it. But there are risks, so it depends on the situation.
It definitely sounds like diagnosis can be a step-by-step investigation.
It really can be a journey sometimes.
So once you have a diagnosis, or at least a strong working diagnosis, what's the approach to treatment?
The absolute main goal is to treat the specific underlying cause we found. That's key.
Address the root problem.
Always.
Yeah.
If it's food responsive, then that strict elimination diet is the treatment. And like we said, you look for improvement over 2 to 3 weeks. But it's important to have realistic expectations.
How so?
Well, for some conditions, like maybe severe IBD or certain cancers, complete resolution of all signs might not be possible. Management might be the goal.
Okay, managing expectations.
No.
What else is common in treatment? You mentioned B12.
Yes, cobalamin, vitamin B12. It's very common for cats with chronic gut issues to be deficient because they don't absorb it well. So we often measure levels and give supplementation, usually by injection, if it's low.
Right. And what if someone finds themselves just constantly switching foods to control diarrhea?
That usually signals something more is going on, and further investigation is really needed, rather than just keep changing the diet.
Makes sense. What about general supportive care?
Crucial, especially if they're dehydrated or have electrolyte imbalances. Fluid therapy, either IV or under the skin, can make a big difference.
And medications. Obviously depends on the cause, but any common ones.
Totally depends on the diagnosis. For IBD, often immunosuppressants like prednisolone or maybe butanide. For small cell lymphoma, usually chlorambucil plus prednisolone. We talked about B12. Sometimes probiotics might help in non-specific cases, though the evidence varies.
Are there meds to avoid?
Generally, yes. Anticholinergics, drugs that slow the gut way down, are usually contraindicated. They can trap bacteria or toxins. And opiate-based antidiarrheals should be used very cautiously, short-term only, as they can have side effects and mask underlying issues.
Okay, focus on the cause, support the cat, use specific meds carefully. What about follow-up? How do you monitor these cats?
Close monitoring is key. Tracking the diarrhea frequency, consistency, body weight, appetite, overall attitude. If we started a diet trial, we need to see if it's working within that 2 to 3 week window.
And if it's not?
If things aren't improving as expected, we need to circle back, reevaluate the diagnosis, rethink the treatment plan, maybe further tests are needed.
It's an ongoing process for chronic conditions. Lastly, what are some potential complications if chronic diarrhea isn't managed well?
The main ones would be dehydration, sometimes severe, significant weight loss, muscle wasting, poor body condition. And in some cases, especially with severe protein loss, you can get fluid building up in the abdomen, called ascites, or under the skin.
Okay, wow, this has been incredibly thorough. So to kind of wrap up, it sounds like the big message is chronic diarrhea in cats, while common symptom-wise, is definitely not simple.
Not at all.
It's a sign that can point to a huge number of different underlying problems, and that means careful observation at home, a thorough diagnostic workup by the vet, and really tailoring the treatment. It's all essential.
Absolutely. You can't assume 2 cats with diarrhea have the same issue or need the same treatment. It requires that individual approach.
Right. And hopefully this deep dive into the information you provided gives everyone a much better handle on, just how complex this can be.
Yeah, a solid foundation for understanding it better.
So thinking about everything we've discussed, especially how connected the gut is to the rest of the body, it kind of makes you wonder, doesn't it?
Yeah.
What other symptoms in your cat, maybe ones that seem totally unrelated, might actually be worth mentioning to your vet? Perhaps something seemingly small could be another piece of the bigger health puzzle.
That's a great point, thinking holistically about their health.
Exactly. Well, thanks so much for joining us for this deep dive.